Welcome, and thank you for attending this webinar on e-statements. My name is Amritpal Diyal. I'm the Director of Client Relations Management, and this webinar is part of our CRM's continuous endeavor to provide educational material to our providers. I will be moderating this session. Just a quick refresher about MTBC. MTBC was founded in 1999 and currently serves 35 unique medical specialties in 43 states. We have over 1,200 employees, and our operations are 24/7. For the past 3 years, we've ranked among Deloitte's Technology Fast 500, and for the past 2 years, we've ranked among the Inc. 500 and 5,000. We are a Microsoft certified partner, a SureScript certified solutions provider, and we provide a certified EHR. E-statements are a paperless solution that will increase payments and reduce your days in account receivables and the volume of patient calls. This webinar on e-statements will cover the basics. What are electronic statements? Are electronic statements secure and in compliance with HIPAA? And do patients prefer electronic statements over paper bills? Why are e-statements better than traditional bills? And finally, how can you transition to e-statements? To begin, let's cover what is an e-statement. What is an e-statement? An e-statement is a secure message that provides patients with their bills electronically. It will allow patients to pay balances online. It'll allow them to email questions regarding their bills, and it'll give them access to previous statements. It'll give them access to previous statements through MTBC's patient portal. One of the biggest issues I run into when I bring up e-statements with providers is whether or not they are secure and whether or not they're in compliance with HIPAA. So to begin, I will go over HIPAA. The Health Insurance Portability and Accountability Act of 1996, otherwise known as HIPAA, protects health information of patients, and covered entities must adhere to these privacy rules set out in HIPAA. For all intents and purposes, MTBC is a covered entity and must adhere to HIPAA's privacy rule. The information that's protected under the privacy rule is known as protected health information, and PHI can be defined as any individually identifiable health information that is transmitted or maintained in any form or medium. That means electronic, oral, or paper, by a covered entity that includes providers and MTBC or its business associates, excluding certain educational and employment records. Individually identifiable health information is information that relates to individuals' past, present, or future physical or mental health or condition. An example of PHI can include your patient's name, address, birth date, email address, health plan beneficiary number, account numbers, medical records, so on and so forth. The question then becomes, how are e-statements in compliance with HIPAA? HIPAA provides an exception to the disclosure of PHI. A covered entity can disclose the minimum amount of PHI without an individual's authority to obtain payment. Under HIPAA, payment includes billing and collection activities, which is what an e-statement would fall under, billing and collection activities. MTBC's e-statements will contain the patient's name and email address. This communication will serve to notify that an e-statement has been posted to their patient health record account. Our communication would be properly encrypted, and as stated earlier, we're using the minimum PHI necessary to send the information, just the name and email address. E-statements are actually more secure than regular mail. Our e-statements are encrypted, and they'll go directly into a patient's email inbox versus a paper statement that is going into a mailbox. Now that we've covered the compliance and HIPAA concerns, we'll move on to the actual benefits of e-statements, what the numbers say. The Healthcare Financial Management Association recently released a study comparing paper bills to e-statements. They measured that patients that received traditional paper bills, printed, mailed, and then mailed back with payment, take an average of 16 days to make a payment, versus patients that receive an e-statement, who take an average of 3 days to make a payment. This study went further, finding that paper bills have a 77% full payment rate, as opposed to an e-statement, which has a 95% full payment rate. Furthermore, 40% of patients that receive an e-statement make their payment the same day they receive their bill. This goes to reduce the days in account receivable. We have run a beta test for e-statements with our providers. MTBC provides e-statements to a few providers. Based on their averages, we found that paper statements were paid after 16 and a half days versus an e-statement, which took 6 days. The payment rate for a paper statement was approximately 45% versus an e-statement, which was at 80%. Overall, e-statements are better than traditional paper bills. Besides the obvious green effect of not having to print paper bills, e-statements allow patients to have billing transparency. It gives them instant access to view current and previous bills, instant ability to pay current or previous bills, instant ability to manage their healthcare bills and their healthcare online. It reduces mail clutter and eliminates postage costs. In a 2009 Press Ganey report, the group least satisfied with their healthcare experience were those 49 years and younger. This is because those generations are accustomed to faster, easier, and more accessible services from every industry, and they expect the same from their healthcare. Many industries have already made the transition to e-statements. Patients are already accustomed to going online to pay their power bills or their credit card bills and do their banking. This transition will not be that, and which will make this transition easier. When can you go paperless? As mentioned previously, we are currently providing e-statements to a selected group of providers. If anyone is interested in making the transition, they can contact me at adl@mtbc.com, and we'll work with you to help transition from paper to e-statements. Questions. A lot of the questions that I receive are whether all of their patients, providers' patients, must transition to e-statements. And the response that I have to that is, we're currently working on creating a system that allows patients that would like to have e-statements, the 49 years and younger, to have them, versus most patients that, for example, are Medicare patients who probably don't have access to email to still receive paper statements. It's time to make the transition. We want to work on making that transition smooth for their practices and for their patients. Before we end, I just want to quickly go over some of MTBC's value-added services. We provide the lab connectivity, a touchscreen patient kiosk where a patient can come in and scan their insurance card and check in quickly and easily, which provides up-to-date insurance and demographics. We have our medical transcription service, the appointment reminder calls, e-prescribing, which will allow providers to qualify for the meaningful use bonus, and patient education through ADAM. Thank you so much for joining us. This brings us to the conclusion of this webinar. We will be posting this video on our website, www.mtbc.com, under the resource section, sub-tab webinars, along with a whole series of other useful webinars. In the meantime, if you have any questions or any other concerns, please do not hesitate to reach out to us and to email me directly. Thank you for attending this webinar and have a wonderful day.